Good afternoon, judges and everyone. And today I am Arphakorn from KMITL, and I'll be presenting about the AI assistance for the detection and severity grading of Hallux Valgus. So first, let's begin with what is Hallux Valgus. It is a medial displacement of the metatarsal where your big toe shifts laterally, and it is a very common condition but often overlooked. However, it can cause significant pain, deformity, and limited range of motion. So do you know that up to 70% of the population globally struggle with this condition, depending on the population being studied? It may seem like a minor issue, but many people struggle with pain, limited mobility, and even falls. So it might seem like a minor issue, however, it causes a healthcare burden. And so why does this condition often get diagnosed at a very advanced stage? So what happened is that with the current diagnostic methods, which is usually visual inspections and radiographic methods, patients usually come to this stage only when it's already reached at advanced stages, where they're already pain and limited mobility. So this really suggests the lack of early screening. So this is our pain point, and how we address this pain point is that we uses an AI screening tool into detecting this condition that is accessible and accurate, so that it can be used even by the non-specialists or the patients themselves. So for the methods. So first of all, what we did is that with the data collection, we sources at 285-foot images by using an open source databases, and these images will undergo the data organization and pre-processing. So these will be resized to a 640 by 640 pixels, undergo the ortho-orientate, and also undergo rotation and brightness adjustment. So after all these augmentation techniques, we will have a 683 images, and what these will undergo a model training, which is a machine learning, an AI platform. We will use two platforms in this scenario. First one is RoboFlow. It is an online machine learning platform, which is designed for a computer vision task. It has an advanced option for data processing and augmentation. And another online platforms, which is a semi-supervised platform based on the mobile network. It is very user-friendly, very easy to use. However, it might be lack on the limited and customization compared to the more professional coding tool. So for the performance evolution, we look at the mainly three metrics for the evaluation, which is first, accuracy. So how often does the AI tool make the correct prediction when looking at the foot images? So, and secondly is precision, which is when the AI says someone has the foot deformity, how often is it right? And for recall is that out of all people who actually has the deformity, how many that the AI actually catch. So that is, recall is a concept very similar to sensitivity in terms of diagnostic tool. So for the results, RoboFlow, we can see that the precision of this model is 72.9%, and the recall is 80.4%. And for the accuracy, there are a total of 4 classes for the severity of the deformity. For the accuracy, we can see that for the not very severe, the very first class, which is a mild one, the AI has done a very good job in detecting. However, if you look at the more severe severity, we can see that the AI hasn't done a very good job. What we can say from this is that the AI cannot tell apart the moderate deformity from the severe deformity. However, it did a very good job on telling apart the normal and the deformed foot. So it has a high sensitivity, but however, it cannot classify the data into a classification whether this is severe, if this is moderate. However, another platform, Teachable Machine, what we can see a very opposite trend here. What happened is that it did a very good job with the severity grading. It can tell apart the moderate and severe deformity. However, it struggled more with the mild cases, which is the almost normal looking one, but still has the deformity. So what we can say from this result, what we conclude from this result is that for the first platform, the RoboFlow, it did a very good job from differentiating the normal from the deformed foot. However, it struggled with the severity grading. This makes it more suitable for screening. It can tell that, oh, the patient has the deformity. However, for the teachable machine, the second platform, it performs very well with the severity grading, and however, it cannot detect very well with their mild deformity. So it may be more suitable with adding the severity grading with their physicians so that it can possibly help with the clinical outcomes and decisions. And despite all these results, the limitations of these platforms is that it is a semi-supervised learning constraints. These models are online platforms, very easy to use, very easy to train. However, you cannot edit the code yourself. You don't do the coding part, and that's when the constraint come in. That's when the limitation is. And the yielded overall accuracy still make it insufficient for us to limit the severity classification. So what we want to do with this is that we want to expand the data, uses more image, more diversity, and uses a platform where we can edit the code ourselves. We should be able to edit code like sentence by sentence so that we can make it customized to our data set, the foot images. And another thing to make it more accessible to patients, which is our target group, the non-specialists to detect by themselves, is to integrate with the real world tools such as mobile application, for example, so that it is more accessible. And by this, I hope that this is going to change how we approach Hallux Valgus so that we can make the early screening more accessible, and I hope that this is a step towards making Hallux Valgus more detectable at early stages. And thank you for your attention, and I look forward to your questions. Thank you.
Such an interesting topic. Please give a round of applause. Do you have any comments or any questions?
Yes, you did very good job.
Thank you.
So I'm just asking about the gold standard of your detecting. Do you have like how many doctors or physicians doing the judge whether this is the disease or not, and how do they grading the severity for the gold standard compared to the AI detected?
For gold standards, is the radiographic measurements. We measure the angle of the toe, whether how much it deviates and how much it will be called intermetatarsal angles. Well, based on that, and depending on the angles, we classify the severity according to that, and the clinical outcome will be according to that. And for AI machine, which is meant as a screening tool, we look at the length, like how far is the big toe overlapping, does it deviate? So it acts as a screen tool. Oh, excuse me, can you repeat the second question? I don't quite get the second question.
How do you grading the severity? And actually, I have third question.
Yes.
So please answer the second question.
You mean the severity of the radiographies or the severity of the AI machine?
Both of them.
For radiography is the angle in the radiographic. For AI, we classify the image we got into like different category, which is with the help of their orthopedics, and then it is classified into like different folders, and then we put them into the training machine. That's how we classify. Yes.
So maybe I'm not an orthopedic. So
Yes.
How do you like? Would you recommend which of the severity, which severity that should be, which one should get treatment or going to the doctor?
Usually, patients seek doctor when there are symptoms, which is usually moderate or severe deformity. But what our target group is that the symptom develop much earlier than that, the mild deformity one, before the significant pain starts. We focus at that group, and we want these people to be able to access these data, make a modification to their lifestyle so that this condition doesn't eventually progress to a much severe one. Yes.
Very interesting. I would like to just ask, when you said that you might try to apply it to like general people who just take the photo itself, and we also need to look at like the angle and everything. So if just a layperson try to take the photo, how can you actually make sure that it's actually the right way that you want it?
I actually have taken account about that. So what I did is that I tried to use images from different angles with different lightings so that we can minimize these errors possibly made by the patients. And moreover is that we want to create a system where the camera can tell whether this is the right angle, and we can advise the patient or the user who's using the app to tell or to tilt or to make it this angle. Yes.
Thank you.
Thank you very much.